Hey, you've tuned in to the G Free and Happy Show. Tonight, we are talking all about celiac testing for kids with Tom and Lisa with the glutenfreedigest.org. Stay tuned. Hey, welcome to the G Free and Happy Show that happens every Monday night at 7 p.m. Pacific, 10 p.m. Eastern. I'm your host, Kathy, and I have been gluten-free for 5 years and counting now. Tonight, my special guests are Tom and Lisa, who have a wonderful, beautiful daughter that actually has celiac disease. She was diagnosed at a young age. They went through a lot to get her diagnosed. They were great celiac advocates. I had to have them on tonight. We're going to be talking, and that's their daughters there. We'll be talking to them in just a few minutes. But first, episode 66 of the G Free and Happy Show is brought to you by thephilosophy.com. The Philosophy Superfood Powders are blends of the very best plant-based materials on earth. Sophie created some of the best healing superfood powders out there on the market. The Berry Bliss is a stress-fighting, mood-enhancing superfood blend that includes the highest vitamin C and antioxidant content of any whole food, including, any whole food source in the world. So go to thephilosophy.com and say Kathy sent you. It's my last week to have Sophie as my sponsor. I thank her so much because I use that Berry Bliss daily with my protein pancakes and my shakes, and it's just wonderful. It helps me a lot. So let's get started on the show and bring on my guests. Hello, guys. Hi, Tom. Hi, Lisa.
How are you?
Hi. Thanks for having us.
So nice to have you because this actually, I think the month of March is autoimmune awareness month. So I wanted to have somebody to advocate the celiac disease. So first off, tell us a little bit about yourself, and then I want to talk to you about what is celiac disease.
Okay, I'm Lisa. We live in Cherry Hill, New Jersey, and I am a mom of 2 girls, married to Tom for almost 15 years, and I work full-time at a hospital. I'm a director in a long-term acute care hospital out here, taking care of very sick patients. Love my job. And
wow.
One of our sidekicks is that we run the blog and have tried to educate ourselves to help our daughter through what was a difficult time.
Mm-hmm. I'm Tommy. I'm not going to repeat everything she said. A little bit about me. I'm a professional firefighter for over 20 years now. Starting to look down the road at retirement, which will be nice. Start a new chapter in my life. Kind of enjoying the blog and where it's going, and hopefully we'll be able to take it a little bit further. It's exciting to be involved in things like this, to be have the honor of being on your show and being interviewed. It's nice to kind of get our name out there so people know we're available. Just to get the word out for advocacy for celiac disease. It's something that we kind of really wanted to do since Julia got diagnosed. It became kind of like our little our project, and it's really taken off.
Well, and you and the Gluten Libres and a whole bunch, and Taylor Miller, all these that help kind of highlight kids with celiac disease are very important to the community, but also to educate outside our celiac gluten-free community. And that's why I wanted to have you guys on, because I think you went through a lot. I read your story, and I want to talk about, by the way, kudos to what you guys do, both of you. So thank you. Let's talk about what celiac is. What is celiac disease?
So celiac disease is an autoimmune disease. It's funny. I had a conversation at work today with someone who thought it was a wheat allergy. I find I'm always explaining it, but it's an autoimmune disease. You actually have to have a gene to have celiac disease. So there's a genetic component to it.
That is a good point right there, too. Mm-hmm. Go ahead. Sorry.
No, that's okay. I try to often make a comparison so that people understand, because people seem to understand diabetes. And I tell people that people with insulin-dependent diabetes don't make insulin. Well, people with celiac don't make gliadin. And gliadin is required to break down wheat, barley, and rye. So when you have celiac disease, your body doesn't make gliadin. And so you don't have the ability to break down those foods, which can lead to damage to your small bowel, and a tremendous amount of other medical issues associated with that. But essentially what happens is you are unable to break down and absorb those nutrients from food because of the damage it causes to your small bowel. And over time, it can lead to things like bowel cancers. It can lead to neurologic symptoms and problems, and we can talk a little bit about what happened to Julia, but
okay,
that's kind of a quick synopsis of what it is.
And that's important too, that's another reason why I like to highlight all this, is because the sooner you get this taken care of, you have to heal your body after it, so it takes a while. All right, so Gluten Libre Mom is asking, is anyone else in your family have celiac?
Yes, Tommy's mom has celiac disease. She got diagnosed at 58 years old, and not long after she got diagnosed, her sister got diagnosed with celiac disease.
And not you guys, and not your other daughter.
So our younger daughter, who is going to be 5 next month, is being followed by the same physicians that follow our older daughter. And what they're telling us about her is that she has the soft signs, but she hasn't developed enough antibodies to have a positive test yet. We have a gluten-free household, so the only thing that she eats, we keep 1 loaf of bread frozen in our freezer. So she doesn't get exposed to a lot of gluten like Julia did, but she is showing some early signs. But we're much better prepared this go around than we were a few years ago.
I bet. That must have been. Okay, so let's start talking about this. So she was diagnosed. Mm-hmm. Now tell us her symptoms first.
Well,
or if you want to start the story, go ahead. However you want to start talking about this.
Okay. Well, Julia was actually tested for the first time at 17 months. She was a child who had frequent bowel movements and skin rashes and other problems, and we actually thought at 17 months that she had celiac, and so did the GI doctor we took her to at the time. We were sent by our pediatrician. She went through the testing. They actually did an endoscopy, and everything came back negative, and they told us to come back in 5 years, and that was kind of the end of it. Around 6.5, she started to have some mild symptoms. She was having belly pain, which we took her to the pediatrician. At that time, I asked if we should have her retested, and they told us it was constipation and we should start her on Miralax, which I didn't really understand because she ate a very high fiber diet. She drank tons of water, and it didn't make sense because it wasn't her normal bowel habits, but they said it's very common in children, regardless of what they eat, and it was infrequent at the time. And that continued on and off for about a year. And around 7.5, about a year later, she started with canker sores in her mouth, and they were frequent.
And the headaches.
The headaches came like at the very end, I guess, right before we took her for the testing. Light cramping, which we kept telling her were growing pains. We went through that. We said, oh, you're having growing pains. And she was continuing to have the stomach issues, and when she started 3rd grade in September of 2011, she started having headaches, and she had never complained of a headache in her life, ever. And she got sent home from school with a headache in the end of September, early October.
That was the start of all really everything. Her coming home a lot.
She was getting sent home from school. She was at the nurse a lot, and we were actually at our chiropractor's office, and I had made an appointment for her at the pediatrician that night. And that 45-minute ride between the chiropractor and the pediatrician, the light bulb went off above my head. It was just talking to her and trying to figure out what might have been causing the headaches revealed all these other things to me. And by the time I got to the pediatrician's office, I said to them, well, we came for headaches, but it's more than that. I think she needs to be tested for celiac. And they said, nope, we're going to treat her for headaches for 2 weeks, put her on this medication, take her home, and we'll see her in 2 weeks.
Wait, so that's what they did? Because I want to ask about that too. But so Gluten Libre Mom is saying that Kai had headaches all the time and almost every day right before the doctor. And then she also asked, is she maintaining her weight?
No,
she
lost
was
a lot.
not.
Okay.
She had lost weight, and it was not as much as right before diagnosis, but yes,
Right.
she had lost weight, and she had huge circles under her eyes. And when we go back now, she actually had started. She had asthmatic symptoms. She had what they thought was like a chronic sinusitis, and was taking Singulair, Zyrtec.
Wait, your daughter was?
Yes,
Yeah.
Oh my
Flovent and Zopanex Rescue nebulizers. She was seeing an allergist, and all of that was happening in conjunction, which they were treating like two separate things.
And she was 8 years old, but also during, 17 months to 8 years old, she probably had all this kind of developing.
And I think she had celiac at 17 months
She
old.
was
I think
actually-
she just didn't have enough antibodies, and I don't think she had
Right.
enough damage to her. Like, from what I understand about the disease now, she just didn't have enough damage yet.
Okay,
We
let's
were
talk about
voting-
that part really fast, though, before you go on.
Sure.
So, the reason why you think it was a negative at 17 test is because of why?
Well, what I understand and what I have read and what I understand from our GI specialist is that sometimes they have the disease, but they actually don't have enough antibodies yet to trigger a positive test.
And that's why your 5-year-old is probably
Right.
needs to be tested again. And I'm sorry, Tom, I interrupted you. Go ahead.
No, my only point was kind of in addition to what Lisa was talking about, was we noticed also that Julia was starting to avoid foods on her own. And it's like once everything started to fall into place, when that light bulb finally went off, you start thinking about these things. Oh my, she stopped eating pasta. Pasta was her favorite dish. Pretzels, like soft pretzels, were her favorite thing at school. They were triggers for her to have headaches and things like that, and she started to recognize it herself without being able to verbalize it and really identify what a problem was, but she was avoiding the foods.
And that's
And
another
we didn't
point.
pick up on it. We didn't even recognize that as until the very end when we found out what was going on. We started to recognize, or that all started to fall into place.
Well, and the kids can't understand what's going on.
Right.
So you do have to be advocates for them. And you have to think really fast to try and figure out this while they're going through it and being in pain. And the doctors are giving them all this medication. Jen is asking, what were they doing when you were seeing the doctors? Were you Googling anything? Did celiac come up?
No, we weren't. I mean, we had some knowledge because
your
Tom's
family.
mom,
Right.
but it was different.
Her symptoms were different.
Her
Yeah, we all
symptoms
have
were-
different.
her symptoms were different, and also we actually got a lot more education going with a child through this process than she ever got
Right.
getting diagnosed as an adult. So, and she would, if she was on here, she would say that it was amazing what we learned through this process that she didn't have the opportunity to learn through her own physicians. And I think it's because Julia was a child and there were more resources for us with her in this area. But it kind of, for me, it kind of, when I asked at 6.5, should we retest her, and I got kind of pushed off, I second guessed myself. But in my gut, I always thought she had it.
So they told you maybe, don't worry about it. Is this like a hard test for doctors to do? Why aren't they doing this more often?
They didn't want to commit. It seems like our experience with the pediatrician was they didn't want to commit to the worst case scenario. So they wanted to treat the symptoms first to see if those symptoms were alleviated.
Oh.
And that was really the battle that we started to have at the very end, where we were starting to almost demand that they test her for celiac. They still wanted to continue to treat the symptoms first. They were like, no, let's not go there yet. We're not ready. And no, we're ready. We're ready. So let's do this. Let's not waste any more time. And really, by the time we got the process started and she did get her blood test and we finally got referred to the Children's Hospital of Philadelphia and their celiac clinic, it took 2 months for us to get an appointment. And during that time frame where we knew that she tested positive with blood work, we now had to continue for 2 months feeding her gluten. And
well, see, and that's what is so wrong, because I didn't have the test because I couldn't handle being gluten. Yeah, how did she do that?
It was
for 2
terrible.
months?
It was terrible. She was so sick by the end that the day before her endoscopy was scheduled, her gut stopped functioning completely. And we ended up being admitted to Children's Hospital through the emergency room with her. Our doctor, who's amazing, Dr. Ritu Verma from Children's Hospital, actually called me on my cell phone on a Sunday night while we were in the car after her fellow said, get her to the hospital now. And they ended up admitting her for 3 days. Her gut stopped functioning completely. And everything was coming out both ends. She was so ill. She had lost at that point close to 15 or 16 pounds.
Yeah.
At age 8.
Yeah.
At age 8. And it was terrible. We went through the Christmas holidays with the child who was not well. It was terrible. I look back now at pictures and she's almost unrecognizable.
Her skin was translucent.
She was translucent. I remember being at my parents' for Thanksgiving, and my mom and my sister hadn't seen her in a while, and maybe a month. And in that time, she had changed significantly. I mean, she was so sick at the end. It was terrible. And it's hard because I look back and I can remember that time, but she is amazing and healthy now.
Right.
And
it's taken every bit. And they told us when the diagnosis was done and we had the biopsy, and from that moment we went gluten-free with her. They said it would be anywhere from 12 to 18 months for her body to heal. And I'll tell you, it's almost on the money. It's been almost a little bit longer than that, and we're really starting to see how healthy she is now.
We have a picture of her now that we've been showing, but let's, producer, can we show that picture again? I saw her the other day. Look at how cute she is, and she doesn't look sickly or anything at all. So what would you tell everybody after all of this headache and this horrible process? If you ask me, went way too long. Tell us what tips you would give to the parents out there with kids that, like in the gluten libres too, that had kids that have headaches and they're losing weight and they can't eat much because they don't want to eat anything anymore. Tell us some tips you would do for the parents out there.
Well, I think one is go with your gut. I think as a parent, and this is one of the things we were really supported with at the Children's Hospital, was that they really put a lot of faith in what the parents see with their own children. And so to be sensitive to the changes in your own child, and don't be afraid to ask for what you want from your physician. I mean, I work for a hospital, and our job is to take care of patients, and you have to do that to the best of your ability every day. And it's their job to help us with their knowledge and skills. And I didn't wait the 2 weeks, by the way, to go back with the headaches. I went back 5 days later, and I wasn't a very nice mom. And I demanded the physician look at her and look at me and tell me she wasn't sick. And I told him I wanted a celiac panel drawn. And he wrote me the script. And he agreed with me that she looked sick. But I didn't go back happy to that physician that day. And
glad to hear that.
We did go back to him, and we told him that he really
He blew it.
And he should never make that mistake again with another child, to learn from what he learned from us and to never do that again. And I truly believe, by the way, Julia's asthma symptoms went away.
Yeah, let's talk about, by the way, go to the physician that doesn't help you is a great idea. Okay, so let's talk about what she's like nowadays, and did all the symptoms go away? So tell us.
She's amazing.
Yeah.
She's healthy and happy, and Julia had a lot of, she had herpetiformis dermatitis on her face, which was really tough going through that. She looked like she had blemishes everywhere. It was very itchy. Her skin is beautiful. It's clear. The headaches are gone.
The stomach
pains are gone. She's gained her weight back, plus her fingernails and toenails, by the way, that's a trigger that I don't know if that happened to Gluten Libre, but Julia's fingernails and toenails didn't grow for almost a year and a half. I mean, that seems silly to think about it. You think your kid's biting their nails, but her nails stopped growing.
It's a good tip there. I mean, to look at that.
We didn't pay attention to that. Learn from our mistakes, I guess. But, these are things that you don't think about maybe day to day, but then we realize those things weren't happening. But she's doing great. She is.
She was running track. I mean, she's running cross country.
She rock climbs.
I mean, this is a kid that had no energy to really, do anything, and all of a sudden, now that she's healthy, it's amazing what your body does to help heal itself, because it wasn't very long. Once your body starts to be able to absorb nutrients again, her everything changed. Her color changed. Her affect changed. Her ability to just focus. That was another big thing in school.
School was
hard. She had a horrible time in third grade.
You've heard people talk about that foggy
brain fog. Yes.
Yep.
That was Julia. I mean, completely. We would sit at the table with her at night trying to do homework, and she couldn't even function. She couldn't even keep her head up. And, we thought, oh gosh, she doesn't like school. And we really thought it was all these other things. And
now her
energy is great.
And she's getting A's and B's in school, and things are, things are falling into place. And it's good. It's really good to see. It makes us happy, and she's happy, and she's healthy, and that's great.
It shows on your faces too. I was just going to ask you a question about her. Hold on, I can't remember now. So how is she when she goes to like parties and she goes away from you guys? Does she know the drill, and do the people around her take good care of her?
She's very lucky. She has really great friends. Her closest friends, their parents have embraced her. We have a set of friends who went out and bought a colander to keep at their house for when Julia's there, so they can make gluten-free pasta and strain it properly for her. But we learned. The first time I took her to a sleepover wasn't long after she got diagnosed, and she wanted to go in the worst way. And I had to bring all the food and talk to the mom, and I cried at the mom's house because I was so afraid. I was so afraid, but I didn't want her to not feel like every other kid, and I knew I had to let her have this opportunity and this experience. And it was fine. And so I learned that when she's going somewhere, I asked them what they want me to send, and I asked Julia what she wants, and I don't mind going out and buying everything she needs to take with her. And we tell them, make her waffle in your oven on a piece of foil, and don't use your toaster. And we tell her not to have butter on anything because it's been exposed. And we talk to the parents about it. We just empower her. And that's the one thing that we continue to try to do, is to empower her to have a voice and to not be afraid to, because she's not a real vocal person. She's actually one of the sweetest people. She's such a big heart and very kind and gentle soul. And so we don't want her to be afraid to do that, to speak for herself. And, it's not easy. It's not easy.
It was hard for her in the beginning because she didn't have that confidence.
Good point.
It was something that we had to help her gain. And that was one of the things that we had to do with getting some help when it came to her school, and just being advocates ourselves, trying to get other people to advocate for her as well when we weren't around. So using the school as an example, the school nurse, we were able to use her as a resource just to keep an eye out for her but to also understand that she's going through this learning process herself. Julia was, and her confidence level wasn't necessarily there, which she would be able to ask the questions or at least challenge to see if something was safe or not safe. Today, now that she's more experienced with 2 years into this, she's able to do that. She's able to ask if she can eat something. She's able to read labels. There's apps on her phones now.
On her iPod.
On her iPod.
We put some apps on there to help her, so she has fun when she goes to the grocery store with us.
So she can scan labels to see if something's gluten-free now. But if she's not sure, she knows to ask. And that was a big challenge in the beginning. Trying to get her confidence enough to be able to say, is this safe? Or just have the confidence enough to ask someone else to see if it was safe. So there's definitely some, learning curve there for her. But just as her health has gotten better, her confidence, just in everything that she does in life, has gotten so much better. She starred in one of the lead roles in her school play, and we're like, she's singing.
Who is this child?
Right, like we never heard you sing before. All of a sudden, she's on stage singing songs. I was amazed. It's really cool to see.
A nice silver lining, yes.
There's one thing we did, and I don't know if everybody has access to this, and I know this is a sensitive subject in life, but we were able to access a counselor, a psychologist actually, at our hospital where she's treated. They have a celiac team, and it was a wonderful tool for Julia. And this psychologist only works with kids with GI issues, and she's part of the celiac team, and it helped Julia with a lot of the anxiety and what the counselor said is living in a gluten world. How do you acclimate to that? And it was great for her, and it was great, and it was something just for her. It was somebody, not mom and dad to talk to, or even her Nona who understands, but somebody completely outside of that, of her family.
Right.
And she would ask us to go see her, and she would. It was great. It was a wonderful tool that we were fortunate enough to have access to.
How'd you find that out? Because you work there, or did they tell you that happened when she stayed at the hospital?
They actually had.
It was part of the plan.
It was part of their plan. After she got diagnosed, they brought us back for a full day. It was like a 4-hour course.
Yeah, it was an orientation to celiac disease.
And we had a dietitian speak to, it was us and another family, and so they talked generically. Then they had somebody else come in from the team, a nurse practitioner, and speak to us. Then we went separate, and they focused specifically on Julia's lab values and what we had to do nutritionally to support her specific needs. And in that mix, they gave us the option to access this counselor. We had to use our, through our insurance, but it was, I'm so thankful that we had that opportunity, because it really did help her in a way that I'm not sure. I mean, we love her, but it was so important for her. She did have a lot of anxiety, and, it was years of not feeling well. And I think about that, how long she didn't feel well. It's a long time for a child to remember feeling bad every single day.
And it's it probably validated what you guys were all saying too. It's kind of like, oh, I better listen to her because it sounds like I have something bad or something
I think part of it
interesting.
Was also just her ability from a professional standpoint to probably answer questions from a trained point of view, as opposed to mom and dad saying, you should do this because this is what mom and dad think. So I think that was an asset to have her as a resource, because she could ask questions to her without necessarily maybe having a feeling of repercussions because mom and dad were going to yell or whatever it is that she may be thinking. Now she's asking a third party who's an expert, and she may be providing a better answer, or a better descriptive answer.
I had never heard of that. That's really nice that you guys had that resource, and I'm hoping everybody else checks that out in their hospitals and their doctors or where community. There were you're going to check your other daughter again in the near future?
We are. She's actually going to be, she's going to have the genetic testing actually for the HLA, DQ2, and DQ8 genes soon, actually within the next month. And she's actually been tested 3 times already. Our doctor at Children's Hospital recommends once a year through puberty for her.
Nice, because you have the celiac disease within the family.
Yeah.
I was just thinking, as you guys were talking, there's so much that you guys went through and all the research you guys did, and you know, the other parents like the Gluten Libres and Taylor Miller's mom. You all should join or, you know, collaborate in a parents club and get going and sharing this with everybody else, because this is great information, and I'm so appreciative that you guys stayed up really late tonight to talk to us.
It's our pleasure. We appreciate you having us on.
Yeah, and I hope to have you guys on again with your daughters, and maybe you can talk about some of the things you love the most in the gluten-free world too.
We'd be happy to.
Good. Hey, you guys did great, and I want to thank you again. And let's tell us where we can all find you so we can all follow up and ask you questions or whatever else they need to do.
Well, we have our blog site is glutenfreedigest.org. You can also see us on Facebook with Gluten Free Digest, the same name. Just look it up on there. And we're on Twitter at @4glutenfree. I think everybody that's been paying attention to our little chat tonight's probably seen us, so a little shout out to the Gluten Libre out there.
I'm sure he's cheering you with his gluten-free beer, because that's what he was going to
I
get.
want to know what he's drinking. Is he out there? Can you chat that answer?
Hey, Brian, what are you drinking for everybody? I'm not sure which. I think Gluten Libre Mom is talking, but hurry up, Brian. Okay. Tell us what you're drinking. They're usually better. Maybe they had to step out. Darn it, if you just gave him a nice, well, he'll watch the end again, I'm sure.
That's all right.
But they like the Red Bridge.
Okay. Yeah.
What do you guys drink in the beer situation there?
There's a bunch out there. Glutenberg, New Planet.
Oh yeah, New Planet. I don't know the other one.
What's the one I made the corned beef in?
Green. It's a one from Europe. That's a really good one.
It's really good.
My favorite one when I have one of those. It's the greens.
It's
great. Otter Creek just came out with one called Grist, and that's certified gluten-free also.
Good to know.
Yeah, so I haven't had that one. I'm familiar with. I've seen it before, just never tried that. And of course, Dogfish Head has their tweez and nail, like that style.
Yes.
But we stay away from the other questionable ones. We'll leave them off the conversation.
Okay. And also, you guys should tweet more about what you guys eat and drink for the kids too.
Oh, we will.
Yeah, and so I'll have you back on the program highlighting those. But thank you both again.
Thanks for having us.
Appreciate it. Thank you. Fun.
So everybody please check out their website, the glutenfreedigest.org. Follow them on Twitter. Learn a lot about how you can help be an advocate too for the celiac disease, because I think it's really important. So until next Monday, this is Kathy with gfreeandhappy.com. Have a great G-Free week.